Thank you. Well, you always wonder, what will I follow? Christine, you were fabulous. I did not predict following a plea for a stool sample, though. So I'm not sure where I'm going to go from there. But I do, before I even start, I want to say I researched this group, and I was very impressed. But I want to say, working for Lilly, we look for groups that we can partner with that have 3 really strong pillars. And those pillars are patient education, patient support, raising awareness of their disease. That's one pillar. Patient advocacy, and raising money for research. And you guys have it all going on. And a fantastic director. So give yourself a round of applause. Really, really fantastic. So I want to tell you a little bit more about my background, just to kind of set the scene on how I'm here today. So I'm by trade a biochemist. And you're like, why are you in patient advocacy? Well, I started off in cancer research and bench research, and I'm a biochemist. And I moved from there into patient safety. Just by coincidence, when I was getting pregnant, I couldn't be with all the carcinogens. So I moved into patient safety. I kind of thought it was like lab safety, OSHA, keeping people out of trouble, but it was actually where you measure adverse events so you can give physicians and patients a good way to measure the benefits and risk. So I stayed there for a long time and ended up working a great deal of my career with regulators to try to centralize regulations and make it easier for people to understand those risks so they could decide whether or not to take a product, if that makes sense. So I moved from there to corporate affairs, which is a strange move again, and moved into anti-counterfeiting. Okay, I know that's bizarre. And it is bizarre, but one of our medications was one of the most counterfeited medications in the world, and it's Cialis. And I won't talk about that today because I hear a few kiddos in the audience, so I won't go into that. But really, it was unsafe for people to take counterfeited Cialis, and you can see the connection there. But I really, what I was able to do when I was there is to convince a couple governments around the world to pass legislation that prohibited illegal trade and illegal sales of medications on the internet. So what we did was we advocated with government to pass laws for the sake of patient safety. So that, you can see my path now. And once I did that, I was done with what I started, and I was looking for my next career move, and it was very easy for me to see what I wanted to do. I wanted to go back into oncology, absolutely wanted to go back into oncology, and I wanted to be the voice of the patient. So I moved into patient safety. I moved into patient advocacy, where I am today, and I've been there for a little over 4 years. So I sit as a professional patient advocate. And it's a strange, it wasn't serendipity, it wasn't fate, it wasn't lack of planning, it was really this role of connecting the patient and connecting safety and wanting to be the voice of the patient. And I'm here today to talk to you a little bit about how one voice, your voice, can make a difference. So let's see. Oh, it did work. Great. So our mission at Lilly is to unite caring with discovery and to make life better for people. And we take that one step further in oncology, and we say to make life better for people impacted by cancer. And we have 140 years of experience in trying to bring treatments to market. So what you're asking for, you want better treatments. It's not enough. Dietary is not enough. We work relentlessly in an area, and in Lilly Oncology, in none more serious area than cancer treatment, to bring to bring the best innovation forward as fast as we can to help in this area. But what we also realized, and why our mission is what it is that the journey through cancer is not just about getting treated, the medicine. It's also about the emotional aspects, and it's about coming alongside of the patient and their family at that journey, during their journey with cancer. So it is my job and my team's job to support and bring practical solutions and emotional solutions to help those individuals when they're going through this journey. So the way that I do that is I work with patient advocacy groups, and I find those solutions and I sponsor them so that you all can help each other in your journey. So I think that Christine was just alluding to that, having her partners stand up in the last initiative to say we're bringing this alongside with partners to help people come back to treatment. So that's my job at Lilly. It's a good job. So I spent years in the lab hearing about bad stuff, and close to 15 years in patient safety, collecting anything that can go wrong while people took our products, seriously, all the phone calls. And then I spent another several years hearing about all the things that could go wrong while people took things that they thought were our products, like this yellow pill that had road paint in it instead of what it should have in it. And now I get the chance, the honor really, to hear from people who take our treatments and it changes their life. And I think I have the best job in Lilly. And I get the chance to hear from those individuals about the gaps in their life, what could help them more than just the treatment, and then to put our heads together with these organizations and find ways to support them even more. And I'm telling you this because I'm not here to advertise for Lilly. We are not the only company that does this. You have sponsors in the room that do this, but as you're putting your head together with individuals, I don't want you to forget about people like me, so you can give your voice to those individuals and tell them what you need and share that voice with them so that they can help you get what you need. So I'm going to tell you a little bit about some examples of how we bring those supports forward. I'm going to tell you some examples about groups I've worked with that have advocated well and what they've done really well. I might share some examples without names of groups who have gone to the Hill to advocate where they didn't do so well. I might share some examples where groups that have worked with the FDA and they didn't do so well, and some groups that did fantastic, just to get you guys positioned in a way that you can collectively work together and move your issues forward. But I will end this all in about 30 minutes because I know you all just drank a bunch of coffee and I want to hear from you and answer your questions. So let me tell you about my business objectives, if you will. My job at Lilly is to work with patient advocacy groups like you to identify solutions that you need, like education, disease state awareness, peer support models, and to help to sponsor those solutions, or in some cases where a small disease state doesn't even have money to, or the resources to know how to build an education, to help them, partner with them to build it, and then partner with them to get it out to patients. So that's part of it. But I don't do that alone. I work with all the teams within Lilly to identify what they're trying to accomplish to make sure that it's a win-win. Like my teams at Lilly want to do this, and the groups really need it. Because if I just did what the groups wanted, my funding would dry up really, really quick. So I look for magic is what I'm looking for. And my colleague came up to me yesterday, and in the world of, I'm going to give a magic example. Okay, in the world of lung right now, there's a lot of immunotherapy, which is really, really exciting. But there's a super small population that qualifies for this great, fantastic new line of therapy. And then there's the rest of the population. Well, there's a lot of noise and videos about this success story, and what's happening to the rest of the population is they're getting really deflated. Our molecules aren't in the new exciting piece, and what we're hearing from the rest of the world is that when they find out they don't qualify for the new exciting piece, they're giving up hope. And in cancer, if you give up hope, it's all but a death sentence. It really is. You need to hope. Your family needs to hope. You need to want to continue treatment, or that's it, right? So we want people to, our business wants people to hope because they want them to continue treatment for obvious reasons. The advocacy groups want people to hope. The families want people to hope, and the patients want to hope, right? So what we came up with yesterday, the groups came to us and they said, can you help us share stories where this side of the world also has success? So this was an aha moment. Okay, we're going to create a series of videos where it is not just these few people over here in this exciting area that has success, but also the people that aren't meeting that criteria. And that's going to give the rest of the population a lot of hope and something to think and dream about. So that's an example. So what we're trying to do is match something that our business needs and something that you all need, and get that funded and move that out to people through you. Because it is a lot more credible when it comes through you than when it comes through us because of the bad press around pharmaceutical companies. Though I hope to change your opinion just a little bit today. So that's one of the things that we do, and I'll give some examples today. The second piece that we do is we work to shape the environment, is what we call, but we'll call it patient advocacy, so that the right patient has access to the right treatment at the right time. We, just like you, don't want somebody not to be able to get something because they were refused by their insurance company, or some other reason they couldn't get the drug. So we work with policymakers, and we work to speed innovation. And I'm going to talk about that a little bit in just a few minutes. So the first part is patient solutions and support. The second part is shaping the environment. And the last part is my favorite part. And that is when you have fundraisers, walks and runs, and you support each other. We don't just give money to support those walks and runs, although sometimes you see our logo, but we bring our employees to roll up our sleeves so that they can meet all of you and that they can help on that day. So it is our community service. It's getting our employees engaged with all of you and helping them understand why what they do and why they get up every day makes a difference at the end of the day. And it's helping you see them in a different light. This is called our Make Life Better. So that's the three things we do. And I'm going to give some really fun examples now, I think. Okay, the first example, this is a big one. Stand Up to Cancer. Who's heard of Stand Up to Cancer? Some people. They have a pretty big telethon on the television, and there's some pretty big entertainers on that telethon. But this fall, or this March, Lilly Oncology teamed up with the Entertainment Industry Foundation and did a public service announcement on colorectal cancer. And we did that because what we were trying to do is trying to get colorectal cancer patients to get to the right treatment the first time, like breast cancer patients do. You hear these breast cancer patients say, I'm ER positive or hormone receptor positive, so I got this treatment. Or I am this, I have this type of cancer, so I got that treatment. And so what they're doing is they're getting their tumor typed, and then they're getting the type of treatment that best responds to their specific tumor, and it's much more responsive. And the same thing is happening in the colorectal cancer area, only patients aren't getting their tumors tested and they're not getting the best treatment for them. So what we did is we teamed up with Stand Up to Cancer and Greg Kinnear. He's handsome and he was super, super nice. And he was really, really nice. Like, he wasn't supposed to do some things, and he's like, I'm gonna do them anyhow. He went on the Today Show, and he did a couple radio campaigns. He just threw them in for free because he loved it. And I can imagine, he gave his name to Stand Up to Cancer, and he said, I wanna help. And I can imagine when someone said, oh, can you do it with a colon? What he thought was like, oh, all right. I guess I have a theme today. I didn't mean it to be my theme. There is no way when I was practicing was that my theme today. But Greg did a great job with this, and really what we did is when we did this PSA, we put these posters all over in train stations, all over where people would see them. We put this PSA in the middle of Times Square. It was everywhere, and it sent you to a link that went to 3 of the primary patient advocacy groups that then had you learn about tumor typing, and then sent you to your doctor to get tumor typed so you would get the right treatment you needed. And the amount of hits and the amount of education that produced was those advocacy groups like you, their highest hit rate of the whole entire year, and the highest hit rate on an education campaign that they have ever done. So it was absolutely a win for everybody. And that was just a great example of something you can do, but it was really specific. So it was not about boiling the ocean. It was about taking one thing, like I will take kudos, like yours, getting people back into treatment. One thing and driving it forward and doing it in a big, bold way. So I think that's a good example of raising awareness. This next one, I'm gonna let a patient speak for me, because after all, that's what I said I do. I provide the unfiltered voice of the patient. So I'm gonna stay true to my mission and let a patient speak for me.
Before I was diagnosed, I was an attorney practicing commercial litigation in real estate. I loved what I did. I had my own practice for 10 of the 14 years, and I loved helping everyone in the community with their issues, and people would just come to me, and I had a very active practice. The first sign that I had that something was wrong with me was when I would swallow food and feel like it wasn't going all the way down. But then I started getting really tired. I was exhausted and I knew something wasn't right. So that's when I went to the hospital, had a lot of blood work done, and they said, get back here. It's a mess and something's really wrong. So within a matter of a few days, they realized through a lot of testing and blood work, mammograms, ultrasounds, endoscopy, PET scan, that I had stage 4 stomach cancer. When I was diagnosed, there were no support services at all for stomach cancer patients. There was no information on the internet. There were no groups for stomach cancer survivors. Nobody else to talk to about stomach cancer. And as I went through that initial 13 months, I thought, I'm actually lucky because I'm still here. I'm a survivor. and I want to help others. I had access to medical information that others don't have because my husband and my dad are doctors. And as I started talking, especially with my son, realizing that maybe this is something that we can help others with. And so we started Debbie's Dream Foundation, Curing Stomach Cancer. We started chapters all over the US and abroad as well, in Canada and Germany. We have a medical advisory board. We started adding international as well as the US to help people. We started a patient resource education program that we call PrEP. We prepare people for the journey. We match them by stage, by biomarker, by age, gender, region, country, and they can talk to somebody else who is of the same stage. So if they're a stage 4 patient, they get to talk to another stage 4 patient. So they get to have that mentoring that I didn't have, that a lot of people 6 years ago didn't have, but we have now.
I think I have to click it one more time. So I actually clicked it one extra time. Pretend like you're still talking about Debbie. So when I met Debbie, she was in South Florida, and she had a great idea and a great organization, but she was really not reaching as many people as she could. So we met with her, and she had the 3 components I was talking about: patient education, patient support. She had an idea for advocating for faster cures, and she had a good model for raising money, basically, and a model to fund research. But she didn't have a big pharma funder yet, or another big industry funder. It didn't mean to be pharma. And she didn't have education materials that would get out very far. So what I saw is we were just getting ready to launch a gastric cancer drug, and what we were able to do was to partner with her to develop Stomach Cancer 101 materials so that when someone was diagnosed, they could hand it to them and they could understand their disease. Because if you looked on the internet at that time, it just said, if you're diagnosed with stomach cancer, go home and don't receive treatment. It just said, go home and get your affairs in order. And it just was not, or it would say, I remember Googling something else, and it would say, if you're diagnosed with stomach cancer, you should take these mushrooms and not chemotherapy. I was like, are you kidding? That was like the #2 Google hit. So there was a long way to go for this organization. And I was really happy to team up with Debbie to kind of beef up her PrEP program and her patient resources, and to work with her to get other industry partners on board, a couple other pharma companies, and she also brought in some non-pharma companies. So it was a great win-win for everybody. So I just wanted to bring that as an example of one person, just one person, who started in an area and there was nothing for her, and she decided to make a difference. That's just one person that did that. She's phenomenal. The next part of my slide says PACE, and you're all like, what is PACE? It sounds like the monkeys are coming in, doesn't it? Like, did the children escape from the children's zone? They might have, I don't know, but that's okay. If they have, I can handle them. But PACE stands for Patient Access to Cancer Care Excellence. So what we did about 7 years ago is we built a policy platform at Lilly. And that was to bring in a network together of cross-functional players. It included oncologists, health economists. It included payers or insurance companies. And it included everyone across the board to sit at a table. The people who were really doubting us, or our adversaries in the media, sat across from us people from academics, people from community settings, patients. And it was global, and we sat across and we said, let's talk about the barriers to speeding innovation or getting things to market faster for patients, and let's talk about the barriers to access. So we sat there and we talked through what is our plan to speed those things and how can we work together. And we didn't think that this little group, were going to make a difference, but we said, let's all figure out what we want to work on so that you can leave here and develop your own networks to make a difference. So that we could say, what are the 1 or 2 things that we want you to go out so that we can take this and spread and amplify 1 or 2 messages across the board. Okay, this is what I think your director is asking you to do. So if I think about things that have worked when you think through advocacy, and I think about things that haven't worked, I'm going to give a couple examples. So let's talk about going to the Hill, all right? When people go to the Hill, and they just go to the Hill, and they hire companies, and they make a visit to the Hill, and they get all dressed up, and they go see the Congress, and they go and they tell their personal story to raise awareness for some rare disease. And then they leave the Hill, and they never follow up. That does not work. When somebody goes to the Hill, and I saw PanCan do this. PanCan is for pancreatic cancer, and it is one of the best run groups I've ever seen in my life. They got together before and they said, tell your personal story, start with it. Tell it for about 1 minute. Finish, and then say these 3 points, okay? And then when you leave, say, hey, I'm going to see you back in Indiana in about 10 days. So I'm going to call your staffer, who I know is like my daughter's or my niece or something. And when she tells you I can't see you, I'm going to call her back, because she's like only 10, and I know I can, run her over with something. And when she still says no, I'm going to come and sit in your seat. So remember me. I'm going to bring this cute little picture of this child that I talked to you about, and you're going to remember me then. You've connected them to a personal story, but you have to remember you're not there for that personal story. You're there for the 3 points that your director told you to be there for. Okay, do you hear what I'm saying? You can't be there to push your agenda. You then have to be there to push the agenda of your national organization. That works. I've never not seen that work. So you have to, and if you don't have a Hill day to get introduced, just call them anyhow. If they don't let you in, just knock on their door and show up, and they will let you in. They will. Persistence pays off. Persistence with a smile. Advocacy, not activism. Who knows the difference? The days of throwing blood on the steps like the HIV people did, the AIDS patients did, those are past. That doesn't work anymore. Sugar works. Persistent sugar. So don't give up. Connect them with your personal story, but know your points, your 3 points, and say them like 4 times. Okay, so now I've said that like twice, right? I got to say it 4 more times. I will later. Okay, so I want you to say, in grassroots, advocacy absolutely works. Those people are people you have elected. They work for you. Your stories connect them. You go in the next day, have your neighbor go in. They love this, right? Politics are big right now. They all care. Everybody cares. Get in, make a difference now. Find out when they're in DC. Go 2 days before, because they're going to remember what you said. So all these things matter. I thought the best thing that Christine said all morning is she knew when to hold it, and she knew when to come forward with what your ask was. Because I think it's smart to know when the season is right to get a bill passed, know when the rewrites are going to happen, And when she asks you to do something, do it for her, because if you all don't do it together, it won't get done. So that's what I see really, really works. What doesn't work is going in and pushing your own agenda. What doesn't work is talking so long about your own personal story you don't get to your 3 points. What does work? Sweet, sugar, persistence. It works with us too. Networking, following up. Does that make sense? Okay. I'm going to move forward then. I have one more story to tell about advocacy. I can't remember the name of the person who won't give up for insurance companies. Rainette, I love you. I don't know where you are. You're fantastic. I love you. We were talking with a lung cancer advocacy group, Bonnie J. Adario Lung Cancer Advocacy Group. And we were hearing all kinds of stories about patients being told what to do by their doctors and not really liking what they were told and walking away and doing it anyways. And we were hearing this from the advocacy groups and from the people who navigated patients in those advocacy groups. And we were like, why do they do that? Why don't they tell them what they want? And then the gap, like I said, bring gaps to us. The gap was they didn't know how to tell patients. And especially in our population, which is extremely elderly, because we deal with end-stage cancers. And lung cancer typically that we deal with is with the elderly population where they just don't talk back to their doctors. Talk back. What we call open a discussion. So what we did is we created a training program that was called Shared Voice. And it was really just patients with a doctor talking about how to communicate their objectives with their doctor. And I really do encourage this with all of you as well. But this is personal advocacy. Okay, so this is a different level of advocacy. We had 3 great patients, but one of them was named Hank, and I loved him. Hank was fantastic. He sat there and he said, I've got stage 4 lung cancer, and my doctor was telling me about this treatment, and he was telling me about how my hands and my feet were gonna hurt, and he said it was called something like neuropathy, and he said, doctor, I don't care if it's neuropathy or if it's oldropathy, but if I can't golf, I don't want this treatment. And he was saying, that doctor said, oh, really? That's important to you, like golfing? Oh, well, I've got 3 other treatments you can take. And Hank's point was that just by conveying his wishes, that he was able to go down a different path and continue to golf. And my point with all this is the group telling us that they had this gap in their education was a way for us to step in and help. So this is, and personal advocacy is as important, and this is the time and the place, and your organization can help you do that as well. So just another component to raising the patient voice. Let's see what else I have. Okay, so our last pillar here, I'm closing in on the end, is make life better, but is my favorite one. So we have 3 different areas where we focus on make life better. The first is in the community. The second is when we stop all around the world for a day of the year and we do a day of service. And the last is through global programs. So in the community, we look, and this isn't just in cancer, so I want to tell you about this. We look into a volunteer match database, and people can put in what they're interested in, and at Lilly, their email at Lilly can tell them when something they're interested in has a volunteer opportunity. So there might be a walk or a run or a board position or something that comes up, and they get to engage in the community to help with that specific activity. So that's something that we want people to do. We want them to help their community, whether that's it with hunger or cancer or whatever it is. We want them to get engaged, and we want them to give back. And we want them to get familiar with the people they're helping. The second one is the day of service. And we go out and around, if you're from around here, it's connected with the Indie Do Day, but we do this throughout the US. We stop what we're doing, we give back to communities. And when I first started in oncology, we were planting trees and cleaning up playgrounds and that kind of stuff. But we decided, why are we doing that? Why aren't we doing something for the cancer community? So my colleague, she's over there, Vicki, you want to just say hi? There's Vicki. We started working with groups like Ronald McDonald House and Leukemia Lymphoma Society and Little Red Door and Cancer Support Community, and we decided to get our oncology colleagues engaged with cancer-related projects, and we went and made blankets, or we put together caregiver packages, or did all kinds of things to help the community, and it was a resounding success because guess what happened? They got engaged on that one day, and then they fell in love, and they helped the rest of the year. So it was a really fantastic experience. And the last one is Connecting Hearts Abroad, and I'm going to explain about that in the next slide. So this slide just shows a little bit about everything, but on the top left, it has a lady in a stocking cap. And she is standing in Peru. And she is the founder of a group called A Fresh Chapter. And what A Fresh Chapter does is it takes survivors from breast cancer, well, any kind of cancer. She's a breast cancer survivor, but any kind of cancer. And takes them on a service activity, like a mission activity, overseas, and engages them in a service activity so that they see that they are more than their cancer. They heal. They see that they can still contribute to life. There's something more than just what they went through. And they use each other. It's like a mega support group. And they figure out where they're going to fit in the rest of their life. And they start working on what we call the new normal, which I can imagine is similar to something you all had to work on when you learned of your diagnosis or your child's diagnosis. But this is just a way for them to get re-engaged. And I'm so happy that this year we decided to make this one of our Connecting Hearts Abroad projects when we're going to send 10 of our own Lilly survivors over to this program in Peru, and they're going to get to do this. So I'm really excited about that. It's a great program. And then to the right is a hospital in Kenya where we are working to improve the quality of cancer care over in Kenya. So it's just kind of a big corporate responsibility effort that we're part of, and why my job is one of the best jobs at Lilly. So I'm going to end with this. I'm going to end on a personal note. I'm here not just because I'm a professional patient advocacy individual, and Mike didn't expect this when he found me, but I want to end with my story, my Bella. This is Bella. That little sassy blonde there. She is as sassy as she looks, for real. She really is. My first sign that something wasn't quite right was when the pediatrician at her 6-month check put her up on the bench, and she didn't stand up. She just crumpled. Other kids stand up when you hold them. And she didn't, she just crumpled. And he's like, does she stand up? And she's my third, okay? So I should have noticed that she didn't stand up, but I think I was too busy because I had 3 kids. And I said, no, she doesn't really. And that was the start of things. So he got us connected with PT. And then she didn't really talk like the other kids, but there's a lot of excuses, right? Well, she's number 3 and the kids talk for her, right? So soon she was in speech therapy. And then she would like shove food in her mouth. It was crazy. It was like she would shove so much food in her mouth, like, and then she'd hold her hand, like all of the food on her plate. So we got her an OT. So then she wasn't walking, so we got her those Forrest Gump braces. She was so cute with the Forrest Gump braces. Like everywhere we went, they're like, oh, little baby Forrest Gump. And then, so she was funny though, because she would just like not do something, but then really do it. So she took off her braces one day and then ran like Forrest Gump. And her first words were like, I'm so pretty in the mirror. Not mama, mama, I'm so pretty. But there were other things, ADHD, like I heard people say. There were other things like anxiety, OCD. And then at one point we had her IQ tested, and they said to me, and realized like I've collected all these adverse events, and some of them were for peds, like to figure out if kids had problems, kiddos had problems. So I've heard a lot of things. But so they said to me, oh, she's got mild cognitive disorder. I'm like, okay. And then the lady looked at me and she's like, do you know what that means? And I said, no, actually not really. And she said, no, she's got a mild but an impact on, she's gonna be retarded. I'm like, oh my God, what? Like, and they still kept saying, but nothing's wrong with her. Look, and all of our friends are like, nothing's wrong with her, look at her. And then came the daycare, just you need to tighten up your parenting skills. I'm like, but I have 2 perfect kids, right? Like, I'm parenting these other boys and they're okay. And so then we went to psychiatrists, then we took parenting classes, one of which was like natural consequences, just let them naturally, and I remember, I was like, okay, but she, at this time that it was natural consequences, I'll never forget, she naturally had no consequence for her actions, and she kept jumping from like the top of the mid part of our steps down, and so she broke her foot twice, right? And then we would take her to the hospital. They'd be like, all right, can you step out of the room? Bella, are they hurting you? You know, so it was not the same. So finally, we get her into school and the same thing happens again. She has ADHD, she can't focus, it's just a kid, blah, blah, blah. So finally, I'm like, enough already. So I found a geneticist and I insisted with sugar, I did insist with sugar, to have her whole genome sequenced. Because after all, I am a biochemist. And I just wanted to know. I just couldn't figure it out. And so I had her whole genome sequenced. And up until now, you have to realize, because she had no diagnosis, that basically all of her meds were out-of-pocket paid. So, and all of her therapies. So some of her therapies could be paid through school, but it was never enough, so we had to, have all these private therapy things, which so basically I had to go part-time because nothing could be done in the amount of time I had at night after work. And I was on the fast track at Lilly, and I looked at my boss and he said, you're going off the fast track, and you were one of our few women that we had fast tracked for executive. I said, I know, but it's worth it. So I went and I said I want her whole genome sequenced. And I did, and then the test results came back, and I sat in front of the geneticist, and he said, she has no known genetic disorders. And I went, okay, great, maybe what they're telling me is there really is nothing wrong. And so I really did go to another parenting class. And you start doubting yourself. Maybe I'm making this all up. I'm crazy. And then you think, no, I'm not crazy. And my husband is, I was blessed with a husband that's the yang for me. I'm the yang, or I don't know. So he was just great. She's just Bella. Let's just say she's Bella. Okay, let's just say she's Bella. And I'm like, yeah, but she's more than just Bella. I gotta figure it out. And so finally the geneticist called and said, hey, Cheryl, do you mind if I write a case study on Bella? There's like 3 kids like her in the world. I'm like, what? What? 3? Like her what? Like her what? And he said, oh, come back in. So he showed me her genome. And why I didn't get this, or maybe it was like one of those things when you're a parent, you hear want, and you don't like get anything. But she has a duplication on one of her chromosomes. And what he explained to me is that the clinical side of medicine hasn't caught up to the side of medicine that found this. There aren't enough kiddos to know how her life will play out because there's just not enough cases. So it's probably back to the days of 1934 for you guys. There's absolutely no medicine, there's no cure, there's nothing, but aha, I now know I'm not crazy. And aha, I now can put something in my medical records where I can at least start to get things paid for. This sequencing was $40,000 out of pocket. Okay, so I at least, and then the next thing I did is I marched into school and I said, look, she gets a real IEP. Sit down with me, fix her school. And we did. We fixed her school. And she was in elementary school. I couldn't believe the first time I sat down in my case conference. Do you guys have case conferences? Do you have kiddos with case conferences? Amazing. Like the state calls this case conference. I sat down and everybody showed up. There were like 10 people in the room. OT, PT, speech, development, like all these people. I'm like, are you all here for me? I couldn't believe I had a team of people helping my Bella. And they wrote down her supports that were going to help her, and she blossomed. Not just on her intellectual challenges, her academic challenges, but on her self-confidence. So it was worth the fight. It was worth the sugar. It was worth the persistence. And then we hit middle school. And that was tough. That was last year. And all of a sudden, I saw she was like put in this resource room the whole time. And I went, and they were testing her, like for 8 weeks. I'm like, Bella, have you done anything in class? Oh, we're testing. So for 8 weeks, she didn't do anything in any classes, but they tested her. And so I realized they were just documenting things, and she was in the special needs classes. So she'd been taken off the path for a high school diploma, which is a big deal. So I called another one of these case conferences, and they said, well, her IQ's too low. I'm like, oh, the IQ we took when she was like 4 years old? So I went back and had another IQ taken, and she was okay. Still really low, but enough to be integrated. And we sat down again with this team of specialists, and we got her into all these classes except math, and so they're like, she might not be on the path for a high school. So we worked and we worked and we worked and we worked. And this year she's going to be in 6th grade, although she's going into 7th grade math, which puts her on a path for a high school diploma and leads her into a different future because one person can make a difference for this little baby. And one person can make a difference for each of you as an individual advocate, and you collectively can make a difference. So I just want to tell you to work together, to work individually, and never, ever give up. So thank you for having me.